PCOS.
Mhm.
Can you talk to us about what that is?
PCOS is one of those, I wish it were termed differently. It stands for Polycystic Ovarian Syndrome. So when we use the word syndrome in medicine, it means it has a variety of different things that contribute to the disorder.
Okay.
So it's not just one specific thing. So the reason why it's a syndrome is because it relates to the amount of follicles in your ovaries may be increased, right? So your body's supposed to be doing a certain thing. So I'll give you an example. If it's supposed to say, I'm using arbitrary numbers here. If you're going to have 5 follicles in your ovary, and that's what it does every month, and now someone has 20, that's different what it should do, right?
Yeah.
So you're going to have kind of these fluctuations of hormones. So now we're back to the hormone part of the syndrome, which is we usually see an increase in testosterone. Right? So everything is supposed to be at the level it's supposed to be. So now if testosterone's a little bit higher, it's going to be sending messages not in the way or the amount or frequency that it should be. So there's another thing is how we have our cycles, right? So you start to see your cycles be more irregular. I've had patients who have severe PCOS and they won't have a period for like 9 months or a year, and then they'll get one just randomly. So you have all these changes that are ovarian in nature, but the real heart of PCOS is actually a metabolic disease. So I'll go back to what metabolic means is really the function of how your body is doing internally, usually from a glucose and an insulin perspective. We spend so much time doubling down on the ovaries malfunctioning and it's an issue there and but really a lot of it has to do with gut health, nutrition, and insulin and glucose.
But do you typically treat it by birth control, or how
I
do you
would say
typically...
that's what we typically treat it with. Am I a fan of what we typically treat it with? No, because then we're just focusing on the ovarian portion of it. So many of my patients, I work with functional nutritionists, but I also use that time frame to saying, maybe, so for example, now put you on a GLP, which can then impact your insulin and glucose, and then shift the body's ability to function the way it should.
Wow. So GLP-1s are a medical tool to help balance hormone and regulate hormones?
Absolutely. Well, to balance the insulin and glucose and the metabolic health portion of PCOS. And a lot of times the diseases that we have are from a metabolic perspective. And so that's why when we look at the studies now with GLP-1s, yes, you get the benefit of weight loss, or people are on it because they're diabetics. But when we look at the whole body as this beautiful machine and how insulin and glucose can actually shape or maybe not help some of the functions of the bodies, when you're able to, again, get it back to where it's supposed to be, the rest of the body is like, thank you. Now I can do what I need to do.